Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. When a soldier battles back from serious wounds or injuries, they can either return to active duty or find a new path to success. One soldier working his way back to health grabbed a coveted internship that could lead to a brand new career. Ronald Harris has the story.
The National Geospatial Agency is a unique combination of intelligence agency and combat support agency. They provide geospatial intelligence to policymakers, warfighters, and first responders. Recently, they have found great success hiring interns from our warrior transition units.
NGA, along with other intelligence agencies within the Department of Defense, have been the front runners in our internship program. NGA has successfully interviewed and hired for internships 7 soldiers. One of them, Sergeant Parsons, is one of their success stories.
As you come in, you have to pretty much sign in with different coordinators, and that's where I first met my transition coordinator, Manny. And he discussed, we discussed my background, where I've been, the type of work that I did, and if I would be interested in internships.
Our job as part of our comprehensive transition plan, their medical plan, is to help the soldiers define a career or educational goal. We provide them resources to help them develop those goals, and with the help of occupational therapists and the medical team, we made those goals a reality.
This NGA internship program has been mutually beneficial for NGA and the soldier.
To be able to offer a wounded warrior a position in a company or an organization, and to take our focus off of appointments. And the idea of being able to get back out there is probably one of the most helpful things that I've seen coming into this organization, because once you're able to build your confidence, even if you're returning to duty, you go back to returning to duty knowing that you can do your job.
It's quite honestly probably one of the most important things that these soldiers do. Whether they're going back to the force or getting out of the Army, regardless, they've had some kind of injury that is putting them out of what they've known for the last several years, especially if they're active duty. An active duty soldier knows how to be an active duty soldier, and that's it. For them to be able to show what's on the outside, what additional agencies they can go and work for, what their skills in the military have truly taught them, that's huge for us. And it's really good for them to see that maybe they're hurt, but they can still move forward.
Learning to drive brings a sense of freedom to teens, but it also brings added responsibility. Soldiers from Winn Army Community Hospital at Fort Stewart, Georgia, spent time with students in their community stressing the importance of safety behind the wheel.
From the Fort Stewart U.S. Army Medical Department Activity Ambassadors Program, volunteered with Islands High School on Wilmington Island as part of their Teens in the Driver's Seat campaign.
Teens in the Driver's Seat is a critical program for students that are getting ready to start driving and those that are currently driving, because it's a way for there to be some peer-to-peer conversation about the importance of safe driving practices.
MEDAC ambassadors Staff Sergeant Gillespie Washington and Staff Sergeant Stephanie King volunteered their time to participate in the Teens in the Driver's Seat campaign.
So when we got here and I found out that the group was called Teens in the Driver's Seat, and it was about the safeness of teaching the teens how to drive, I felt like it was an important program, not just for the teens and high schoolers, but for everyone.
The soldiers took shifts tallying up key factors from student drivers about what can affect their driving vigilance. Student drivers were checked for seatbelt obedience and, most of all, cell phone use while driving.
To reach out to the ambassadors to come and support the teens, I felt like coming here, they supported me, they taught me, and they showed me, hey, you need to go out and tell your adult friends, hey, you need to drive safe, put on your seatbelt, don't be distracted, don't text and drive.
According to the National Highway and Safety Administration, 10% of drivers aged 15 to 19 years old who were involved in fatal crashes were distracted while driving.
We have lots of students that are injured or even killed as a result of vehicle accidents, and many of those students would not have been injured or not have been killed had they been wearing seat belts or not participating in dangerous behavior. And the way I look at this, if every kid that's a part of our Teens in the Driver's Seat program learns something and can encourage at least one person that they know to make better choices with driving, our kids are going to be a lot safer.
Diana Shiley, a teacher at Islands, is the main facilitator of the Teens in the Driver's Seat campaign. Shiley stressed the importance of providing an atmosphere that allows students to provide guidance on their negative driving habits to other students.
Teens listen to teens rather than having adults lecture about the dangers. They'll listen to each other and follow the lead. And so our goal is hopefully to lower the number of students who are using electronic devices while they're driving.
To have kids about the same age as the students that we saw today, it really brings it home. I do have kids that will be driving soon, and to be a part of the mission today, it really puts something in me that shows that, hey, this is something I need to be aware of in my own home, and I think that was very important.
After all data was tallied, MEDAC ambassadors and Island students and faculty members met to discuss a strategic communications campaign that would help mediate the distracted driving problem. For Winn Army Community Hospital Public Affairs, I'm Zach Renstrom.
In other news around the region, Kimbrough Ambulatory Care Center at Fort Meade, Maryland showed its continued commitment to health last month during a wellness and disease prevention clinic. 25 staffers provided medical services to more than 60 patients, including lab testing, diabetic foot exams, and mammograms. And finally, Fort Lee, Virginia's Kenner Army Health Clinic earned its credential as a Level 2 patient-centered medical home and was recently renewed by a national healthcare quality improvement organization. The National Committee for Quality Assurance recognized Kenner for building strong teamwork between patients and their healthcare teams. That help promotes better health outcomes. That's the Regional Health Report for April. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. We're also on the Army Medicine channel on the Defense TV app. Thanks for joining us.